Yes, Dr. Tedros and myself and the chef de cabinet returned to Geneva today at 1:30 p.m. So this is our first opportunity to brief you on that. As you will have seen, the Director General, Dr. Tedros, has just announced that he will reconvene the International Health Regulations Emergency Committee on the new novel coronavirus 2019 nCoV tomorrow to advise him on whether the current outbreak constitutes a public health emergency of international concern. His decision to reconvene the committee is based mainly on the evidence of increasing numbers of cases, on evidence for human-to-human transmission that has occurred outside of China. These developments in terms of the evolution of the outbreak and the further development of transmission is of great concern and has spurred countries into action. And we're very grateful for that action, especially in China. What we know at this stage, this is still obviously a very active outbreak, and information is being updated and changing by the hour. It is clearly still centred in China, with the overwhelming majority of cases still being reported from China. However, there are 71 cases reported in 15 other countries. Of note within those cases is the majority of those cases, apart from 6, are associated with travel to China, and of those, the vast majority of those cases are associated still with travel to Wuhan. We're continuing to learn more about the virus, but in doing that learning, as I said, we know that the intense epidemic is centred in Wuhan and Hubei. We know that many people are experiencing a minor form of illness, but still 20% of reported cases are reported as severe, and 2% of confirmed cases are reported to have died. The disease is obviously a mainly respiratory disease, passing via droplets from one person to the other, and mostly still through close contact. The source, as we've said before, is still unclear, and investigations continue in that regard. Prevention of this disease is based very much on what we recommend for respiratory illnesses in general, in terms of keeping distance from people who are sick and the use of respiratory and hand hygiene. And much information is available on that on our website and has been disseminated to member states and the public. And Maria Van Kerkhoff, who's with me here, can give more detail on that. Clearly, we want people who are sick to, especially those with coughs and difficulty breathing, to seek healthcare as soon as possible. During our trip to China, we were very impressed with the level of engagement of the Chinese government at all levels. Personally, I think myself and the Director General have never seen the scale, commitment of an epidemic response at this level, in terms of all of government involvement across all of the different arms of government, with tremendous support being poured into Wuhan and Hubei from the central government, with a highly organised emergency management structure. The challenge is great, but the response has been massive, and the Chinese government deserve huge credit for that response and for the transparency in which they have dealt with this. A case in point, in terms of one of the clusters of infection that we're currently working with Germany to investigate, it was the lab in China who contacted Germany to tell them that they had a return case who was positive. So China is not only helping to manage the cases in its own country, but it is actively reaching out on an individual basis, not only to WHO, but to other partners in the world, to help them respond in a more effective way. As I said, they are taking extraordinary measures in the face of what is an extraordinary challenge. They have, in addition, have agreed to a mission of international experts to go to China and work with Chinese experts to better understand disease transmission, to better understand clinical severity. But I might add that Chinese experts are involved in almost, I think, all of our expert networks, and on a daily basis, dialing into calls on the clinical, laboratory and other aspects of this. So Chinese expertise and scientific knowledge and understanding of this disease is contributing to the overall global expertise. But we're very grateful that China will invite a team to help work with them side by side to learn more about this disease and learn more about how China is taking action. On our side, we have brought together some of the best minds in the world: scientists, clinicians, disease trackers, modelers, logisticians, supply chain experts, and many others from the public and the private sector around the world to examine what we know, the questions we need to answer, and who is best placed to deliver on those answers and those responses. As I said, these networks of experts include experts from China working directly on the response, and that frontline experience, understanding what a frontline clinician in Wuhan is seeing today, is influencing the way in which we can manage potential coronavirus cases tomorrow elsewhere. We're helping other countries to activate their preparedness plans. We clearly have four levels in this response. We have an intense response going on in Wuhan and Hubei province. We have responses going on in other provinces in China where transmission is less intense, the numbers are less, but nonetheless a major response is underway to track cases, contacts, and try to interrupt chains of transmission. We have the 15 countries who have imported cases. They have to stop transmission. Some of them are doing that extremely well. All of them are actually taking good action, but some need some help and assistance with lab and other expertise, and we're doing that from WHO. But the whole world needs to be on alert now. The whole world needs to take action and be ready for any cases that come, either from the original epicenter or from other epicenters that become established. We're sharing information, guidelines and tools in real time on our website and through our partner networks on how to manage the disease, how to manage community investigations, how to manage transmission studies, how to manage clinical trials, and are very grateful for our partners who work with us on the research and development blueprint, for our partners who work from the Global Outbreak Alert and Response Network, from the Emergency Medical Teams Network, and many other networks around the world who are supporting us in this. We're also working to ensure that countries know what supplies to get, what supplies to use, through a disease commodity package, which details to countries the right supplies in the right quantities for certain levels of cases that they might expect. So those countries who have imported cases are clearly at full alert. Those countries who have not imported cases will obviously need to look at their readiness and preparedness. For some countries, this is a very straightforward task. For other countries who are fragile and potentially vulnerable, who already have weaknesses in their public health system, this is a challenge. So WHO is working with those countries to ensure that they have the basic capacity to do diagnostics, case detection, isolation, quarantine, and follow-up. I believe that the world is pulling together to respond to this outbreak. We are at an important juncture in this event. We, as WHO, believe that these chains of transmission can still be interrupted. This disease is still spreading from person to person through personal contact between individuals and through proper management of hygiene, proper management of case identification, isolation and social distancing. Like in previous outbreaks of coronavirus, we may be able to, working with the government in China and other governments, stop those transmission chains. We must make that, we must commit to doing that together. And I believe the Emergency Committee tomorrow will consider the merits of declaring a global public health emergency and the merits of any temporary recommendations that could be made so that all member states behave and act in a coordinated and measured fashion in response to this evolving event. Thank you.